Hello, I'm Justin Gallagher, Associate Publisher of the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Markets News Network. The presidential election is still a year away, but important state elections just took place, and in Kentucky, a new governor could mean big changes for the state's Medicaid program. Republican Matt Bevin claimed victory and will succeed Democrat Steve Beshear, who embraced the Affordable Care Act and expanded Medicaid during his tenure. While Bevin had originally vowed to repeal Medicaid expansion, he has backed off that position. Instead, he wants a waiver to impose cost and eligibility limits on recipients, and he plans to shut down the state-level exchange, Connect, and ask enrollees to move onto the federal exchange. Outgoing Governor Beshear spoke to AJMC about how he came to the decision to expand Medicaid in Kentucky.
I knew that it was the right thing to do, but as a governor, I also had to make sure that it was economically the right thing to do for the state and that I wouldn't make a decision that might bankrupt the state down the road. And so before I made that decision, I asked PricewaterhouseCoopers and the University of Louisville's Urban Studies Institute to come together and do an economic study, an analysis of what they thought that decision would do over the next 8 or 10 years to the Commonwealth's budget. So they worked for 6 months, came back, sat down, looked me in the eye and said, "Governor, you really can't afford not to do this because it is going to, over an 8-year period, infuse about $15.6 billion of new money into your economy. You're going to create about 17,000 new jobs, and it's going to have a positive impact on your budget."
During the last 5 years of life, the cost of dementia eclipses other diseases. A report from the National Institute on Aging found that total expenditures for people with dementia in the last 5 years of life were 57% greater than the costs associated with death from cancer and heart disease. Researchers from the NIA analyzed data from the Health and Retirement Study and linked Medicare and Medicaid records for more than 1,700 Medicare fee-for-service beneficiaries over the age of 70. The report found that out-of-pocket spending for people with dementia was $61,522, compared with $34,068 for people without dementia. NIA Director Dr. Richard J. Hodes said that this study provides an important picture of the risks that families face, particularly those with dementia and those who may be least able to bear major financial risk. Such insights are critically important as we examine how best to support the aging of the U.S. population. The latest hospital safety score report from the Leapfrog Group found some progress, but a lot of room for improvement. Of the 28 measures used to calculate patient safety grades, 8 increased on average and 8 decreased, while the rest remained mostly flat. The twice-yearly report did show a number of positive trends for certain hospital-acquired conditions and safety measures. However, hospitals are performing worse on critical measures like foreign objects left in patients after surgery. Of the 2,540 hospitals included in the report, only 773 earned an A rating, and for the 4th time in a row, Maine had the highest percentage of A-rated hospitals. Leah Binder, President and CEO of the Leapfrog Group, recently discussed the organization's hospital survey and hospital safety score initiatives.
We did market research and we really started partnering with a lot more consumer organizations and patient advocates to really ask the question, what information can you use, can you understand and use? Not information that we in the world of healthcare think is valuable, but information you think is valuable, that matters to you and your families where you live now. So we started the hospital safety score, and that is the letter grade that we assign to all general hospitals on how safe they are for their patients. So it's an A, B, C, D, or F. And it's assigned to all hospitals, regardless if they report to Leapfrog or not.
Finally, there's still time to register for Patient-Centered Oncology Care, which will be held November 19th and 20th in Baltimore, Maryland. The keynote speaker is ASCO President Dr. Julie Vose. Learn more and secure your seat at ajmc.com. For the Managed Markets News Network, I'm Justin Gallagher. Thanks for joining us.